Cool. Okay, well, let's get started. So I'd like to thank everyone for showing up for the Medical Marijuana and Wellness webinar series. Today's topic is fibromyalgia and cannabis. And I'm pleased to have Dr. Michelle Weiner joining us, who's really an expert in this field. Thank you, Michelle, for joining us. And I'll have her say a little bit about who she is and giving her some background. And also we have Claus. Claus, I'll let you talk a little bit about yourself from Trulieve as co-host. So today should be a very interesting topic. I do want to mention up front that we are live streaming this on Facebook. We'll give some information on just a moment. But first of all, Michelle, tell us a little bit about yourself and your background, and give us some.
Well, I am a pain management physician. I practice in South Florida. And I've been practicing cannabis medicine since we've had a program here for about 5 years. I have 2 beautiful kids that are a very big part of my life. And I am very involved with the fibromyalgia population, mainly because the way that I practice as a pain physician, I kind of take a look at the whole person, as opposed to most pain doctors really just kind of look at the area that the pain is coming from. But if you'll hear a little bit today, but we look at a person's pain more, not just physical tissue damage, but also their emotional experience, psychosocial experience as well associated with the pain I practice, which is why cannabis is such a big part of my practice. I also use ketamine for things like pain and fibromyalgia, and really starting on this whole psychedelic renaissance that's happening as well. So a little bit more natural and holistic in my practices, and outside the box of patients who have chronic pain, and Western medicine is not really giving them the benefits right now.
Yeah, I think you brought up an interesting topic that a lot of Western medicine is letting some people down as fibromyalgia and not getting a lot of relief. Let's put it that way. So I'm glad to hear that you're doing that. Claus, tell us a little bit about yourself and a little background, and then we'll jump into, we'll let Dr. Weiner start telling us about.
Thank you, Marc. Thank you, everybody, for joining us. My name's Claus Alfaro. Claus. I've been in the cannabis industry here in Florida for about 5.5 years already. Ever since I've been with Trulieve for almost 3 years now. I am the community educator team lead. I pretty much cover the whole state of Florida, and I do physician engagement and community outreach. So I'm going to be co-hosting and helping Dr. Weiner today with product information regarding the products that we carry at Trulieve that might be helpful with symptoms that are caused by fibromyalgia, and not only fibromyalgia, but other conditions as well that are dealing with cannabis here. So looking forward on a good talk, and thank you again for joining us.
Yes, so good. So let me just go into we don't want to make this slideware, but I do think we need to have some information some slides to be able to talk from. Let me start by mentioning that the first thing is that we are streaming this. It is on Facebook. It's at MariMed Today, Marijuana Med Today. This is the Facebook link. I'll put that in the back up here. I'll put that in the chat so people can see that. And first of all, I want to thank you. If you have some friends who want to take a look at it there, please let us know. Michelle, you do a lot of things. I know you were very quick. Not only are you board certified, but you also help advise the ag department here in Florida, right?
Yeah, so last year I was the chair of the Florida Medical Cannabis Advisory Committee. It's a committee at the Department of Agriculture that's under the Department of Agriculture. Nikki Freed, our commissioners. Hopefully everyone has. And so Nikki and Holly Bell run that department. And now I'm one of the members of that committee. And we basically meet once a month to try to make sure that the program, that we hear from all aspects, from patients to physicians, attorneys, and give suggestions to the Department of Health, Department of Agriculture about our cannabis program here in Florida. So yeah, I'm part of that. And then I also do some research. So I do, I did a project using cannabis as a substitute for pain population in my office. I'm doing a project right now, a research project FAU. We got $75,000 from the state of Florida to study seniors who have chronic pain who are taking cannabis, and very good outcomes already. And then we're trying to get a study done looking at Nano Technology, pharmacokinetic study. And so we could talk a little bit more about that later, because Trulieve has the best in nano edible powder and drops. And I can really discuss why that's a great product, especially for fibromyalgia population. And I'm also faculty at Nova, so I have students who rotate with me, get to see what life is like in a different type of doctor's office, so that they can be exposed to cannabis medicine, their training. I have residents that rotate with me and palliative care fellows as well.
That's great. You also do you're doing a survey with the University of Miami for terpenes.
Yeah, we did a study, we did a survey actually, and it really showed that there's more and more people using cannabis for mental health reasons. 16% of people stopped vaping and smoking completely during COVID. Terpene survey was really looking at the population, and what we found was that they really want to learn more about terpenes, how the terpenes can help them to minimize THC, how there needs to be more education about, not just indica, and understanding what terpenes work best for what conditions, and what how everybody has their own endocannabinoid system. So I think the industry is evolving, and we're trying to do the same.
Yeah. One of the things that we're going to be doing next week is we're going to be doing a webinar on terpenes. So I just thought I'd point that out. So next Wednesday night, there'll be something that's there. By the way, is this screen a little bit better? I think this is clearer than the last one that you were saying.
Looks good.
Okay. Good. Okay. So let's talk about fibromyalgia.
Okay. All right. So let's talk about fibromyalgia. So I kind of want to, I assume most people are patients who are on this. So really to break it down, fibromyalgia has been around for a long time. And if you look at the actual, in the end, the actual fibromyalgia, it just means that there's, fibrous tissues and pain in muscles. And so it's a very interesting condition. Many doctors don't believe in it, and I really think that's because they don't have really good treatment now. It is a big problem. I mean, there's a bunch of people who have fibromyalgia and chronic fatigue syndrome, and a lot of doctors don't, really take the time to actually understand enough about these conditions, but has pain on both sides of their body, above and below their waist, multiple areas that can't be explained with imaging or blood work. And, it's also associated with depression, problems with sleep, fatigue, GI issues. They call it fibrofog, like they're not able to focus. And so really it comes down to this concept of central sensitization, which means that when someone has a certain type of trauma, it could be emotional or physical, or their nervous system is hyperexcitable, and it never really a phenomenon. And that really is what we see with fibromyalgia patients. If you take a good history, you really find out that there's something that started this, and it dates back maybe a long time, and then a second type of insult happened to the body or to their mind. And that's what I find happens with fibromyalgia patients. But a lot of times they're just ending up at the pain doctors, and they just give them medications. It's not really helping. It's a big frustration. But, recently, as we learn more about our endocannabis, Dr. Ethan Russo has really coined this term endocannabinoid deficiency. And I'm going to explain a bit about what it means. Now, if you have a dysregulated endocannabinoid system where you're not making enough endogenous cannabinoids, this may actually be the real cause of fibromyalgia and chronic fatigue syndrome.
That's great. Hey, I'm going to take an administrative break for just a second. For those of you that are on Zoom, down at the bottom of your screen, what you'll see is a question box, the double double bubble. If you want to ask questions, please feel free to do that. For those of you on Facebook questions, and we'll be actually putting those in our chat and being able to answer those as we go along or at the end of the webinar. So let's move on. So tell us what we're finding now about the findings.
So what's very frustrating, so 4 out of 10 fibromyalgia patients, you want to go back, felt their doctors aren't knowledgeable about the condition. 45% felt their family and friends don't take it seriously. Nearly half started their symptoms at a younger age, between 18 and 34. Only 11% were diagnosed within the first year of symptoms, and 44% took more than 5 years before they were diagnosed. So what happens is there's unexplained pain, maybe fatigue, and it takes a really long time for someone to get diagnosed with this. But in the defense of the physician, I will say it's really because they know there's not a great treatment for it. And so if we hear a patient talking about specific symptoms, but we don't have a good treatment option for them, then we choose, it's an interesting topic, because we want to help the patient. At the same time, there's just no pharmaceuticals, there's no procedures that will really help. Now we're learning much more about cannabis, obviously, so it is an option, but it's taken many years for many people to get diagnosed, and a lot of physicians and family members don't believe the patient. So it's a very frustrating patients to be in.
Yeah, and as you mentioned, if you go a couple of years with it, it's also painful. It's not fun.
Right, and the whole time the patient's suffering because there's really not a great treatment, but also frustration of going doctor to doctor to try to get a diagnosis.
Right. So you talked about the endocannabinoid deficiency syndrome. Claus, explain to us what is that?
So we all have something called an endocannabinoid tone. And what this really means is that we have endogenous or naturally occurring cannabinoids. So things that are in the cannabis plant, we make something very similar to THC in our body. We have enzymes that break that down, and we have receptors that are activated by our naturally occurring cannabinoids the way that they're activated by THC. And so the endocannabinoid keeps us all in balance. It's really maintaining homeostasis. It's a whole system to remind us how we're doing. So if we're not sleeping well, if we're anxious, if we have more pain, it usually means that our endocannabinoid system is not regulated properly. And so this concept of the endocannabinoid deficiency, it's been studied, and they have done studies with patients looking at cerebrospinal fluid, and they find that there's low amounts of endogenous cannabinoids in conditions like migraines, fibromyalgia, irritable bowel syndrome, and chronic fatigue. And a lot of times fibromyalgia patients have conditions. So it's really one, a clinical endocannabinoid deficiency syndrome. It's really one condition. There's not any other tests to look, to help a physician or a patient understand where this is from. And it's really something that along the way, they're having a lot of pain. So there have been studies. The biggest issue is that we don't have the ability to test for endogenous cannabinoids currently. And one of the main reasons is because if you look at it in blood, it's constantly changing as we do different things in our life, as we have stress, as we eat. The cannabinoid levels, it's kind of like a blood sugar and an A1C. So they have done some studies looking at, again, cerebrospinal fluid, which is very invasive, so that's not going to happen. But in general, to look into more ways of actually testing endogenous cannabinoids and seeing if a patient uses cannabis, if these levels increase over time.
Sure. So there's some efficacy in medications, right?
So there was a study done. It looked at 1,300 patients with fibromyalgia. And there's 3 FDA-approved medications right now. There's Savella, Cymbalta, and Lyrica. And so they looked at those 3 medications to cannabis, and they found that the patients who were taking cannabis, it was more than 60% very effective for their fibromyalgia symptoms, as opposed to the 3 other FDA-approved medications were less than 10% effective. That's
pretty compelling, I think.
Well, I mean, it's a Okay, so it's not, you know, the strongest type of research, but it's very compelling in the sense, how did these medications even become FDA approved with such a low effect?
Yeah, kind of makes the case for doing more research into medical cannabis.
One quick comment. Dr. Weiner's mentioning about the endocannabinoid. I just wanted to kind of like reiterate or run it by Dr. Weiner. The best way of balancing this endocannabinoid system in our bodies, it's having a proper balance of cannabinoids, and these are found, of course, the cannabis plant, but it's breaking it up and having a good balance between THC, CBD, the other cannabinoids included in the plant, right?
Yeah, no, correct. And it actually has to do with a lot more than that. So it has to do with the food that we eat, because our endogenous cannabinoids are actually made on demand, and they are basically from free fatty acids in our body. So it has a lot to do with the food that we eat and our lifestyle, you know, choices, things like exercising, alcohol, all of these things actually affect it. So there's, you know, parts of the cannabis plant that we can use to supplement, or we can work on helping to make our own endogenous cannabinoids.
So I think there's been a lot of research done. I know most of it, I think the thing to point out here is that most of these studies have been done overseas, but there is studies that have been done to show the efficacy of medical cannabis. And
yes, that survey that I just mentioned, that was in 2014. One of the studies I was in 2018. They showed that just taking, you know, a small amount of cannabis on a daily basis can truly help this fibromyalgia population. And then there was a study that in Michigan, it was also a survey of about 870 people, and it showed that the fibromyalgia population, once they started using just CBD, they were actually able to reduce their pharmaceuticals by 72%. So it wasn't just their pain meds, but it was also benzodiazepine and sleep medication. So there's this huge substitution effect once you start using cannabis, that you're able to decrease a lot of the medication that you're on, because it's really not helping. It's just that there's no other option. So they continue to stay on the meds and even increase the dose over time.
Sure. So tell us about, that's kind of an important part of this.
Right. So this is a, you know, a picture of the endocannabinoid system. See that in light blue is the CB1 receptor, and in dark blue is, or navy, is the CB2. And so you make naturally occurring cannabinoids, or we can use cannabinoids from the plant to activate our receptors. Now, as you see, the CB1 is more in the central nervous system, which is the brain and the spine. CB2 is more in the periphery, the immune cells, our abdomen, muscles, and the THC binds directly to our CB1 receptor. That's why when we use THC, we have more psychoactivity. It's in the brain, right? So it treats nausea and vomiting. It helps with pain, helps with sleep, because the THC binds lock and key to the CB1 receptor. Now you can see, on the other hand, the CB2 receptor, there's certain things that can actually bind to that, like beta caryophyllene, for example, which is a terpene, but the CBD doesn't bind to these receptors. So that's kind of why I always say that we know that whenever you use CBD, you need a small amount of THC to really have the best effect. And it's really because CBD is like a modulator. It will inhibit the enzyme that breaks down our natural endocannabinoid system in imbalance, but it needs THC to activate the receptor. And so the other thing is, besides it not binding directly to that receptor, when you use it with THC is a little bit less strong. It's called a negative allosteric modulator. So instead of THC, when you get with CBD, it changes the shape a little bit, so THC doesn't bind exactly like a lock and key. And that's why we use CBD to mitigate some of the intoxication when we're using it with THC. So other cannabinoids as well, CBN, for example, we use that for sleep. But again, that's with THC. So it's important to understand that THC really does activate the receptors, and other cannabinoids work systemically And then understand that this is the CBD, the CB1 receptors in the central nervous, why we're having psychoactivity and things related to our central nervous system.
Sure. And if you take a look at how it works, endocannabinoid, your body produces endocannabinoid. I'll let you walk through this one. Something that supplements what your body's doing.
Right. So as I was saying before, it's a good slide. It shows that like food, like fats, for example, that we're eating actually allow us more endocannabinoids. And these cannabinoids can be made in our body. We can take them in the cannabis plant, meaning phyto, meaning plant, or synthetic cannabinoids. Synthetic is like marinol, for example. Marinol is basically THC in a pharmaceutical capsule, and if anyone has ever used, not very effective. It doesn't really cause the same type of feeling that THC would. It barely treats pain. Like we use this in skilled nursing facilities. Times we use it in the cancer population, and it really doesn't work as well. Mainly, because it's synthetic, but also because it's just one isolated molecule. So it's, the cannabis component that now is giving you just the THC in a synthetic form, which again is in a capsule, and you're going to lose a lot of the milligrams anyway. So there's different ways of using it, but obviously the plant has the entourage effect and all, so that it works synergistically to have a better outcome.
Yeah, and the endocannabinoids helps with pain, appetite, immune system, mood, memory, and as you mentioned, it's by your nervous system, by your neurons, which means your body knows where it has a problem. It doesn't need a doctor to tell you, and that's where if you have a couple of issues with your body, cannabis works on both of those issues, which is called the entourage effect. You're treating it for one thing, and it helps something else as well.
Right. I mean, the endocannabinoid system is a master regulator, and honestly, people need to learn to listen to their body, because if they have a symptom, if they have something that they find that they need to go to the doctor for, well, obviously the endocannabinoid system is involved, because it's involved in different processes.
Right. So tell us a little bit about cannabis.
So cannabis is a beautiful plant that we all should appreciate and respect. It has 104 cannabinoids, which is more than just THC and CBD. There's CBN, CBG, CBC, THC, cannabinoids. And then there are terpenes, and terpenes really need to get a little bit more credit and attention. And, they are the essential oils of the plant. They're what gives the plant its smell, but also what helps to guide. Someone uses THC by itself, it may or may not do anything, but when you it will actually give you the effect you want. It can help you sleep. It can help you have energy. That has to do with the terpenes. So the issue right now is the terpenes are difficult to study, and we're not really aware of how many milligrams we need, or we're just used to what flower has in it. And so when we're looking at other delivery methods, we're not really sure yet, and that's where the evidence has to come, seeing delivery methods, but overall it makes up the entourage effect.
And we do know that terpenes are very effective, like for example linalool and myrcene and limonene are very effective in helping various.
And I'll add something, even though you have the terpenes talk next week, which is going to be really interesting, but I was making a comparison the other day that terpenes, when you're making a recipe, you have different ingredients, and you can look at the terpenes as if they were the ingredients for that recipe. So for example, when you're cooking or baking and you want to achieve something with that particular recipe, you're going to add different ingredients in order to have the final result, where you are going to have specific terpenes in a specific strain profile or cultivar or whatever you want to call it. And that specific terpene, it's going to give you, or it's going to work against a particular symptom. So very important to break down the whole plant and getting into into terpene, more than sticking with strains and categories.
Right, and like we a lot of times we'll say THC is the engine and the terpenes are the steering wheel, right? So like THC is a driving force. When you add the terpenes, then it guides you where you want to go. Or I always say THC is like the lettuce, and then when you add when you add the terpenes, you get the salad, because we have to make healthy references.
Yeah, exactly.
There you go. So you also have a synergistic effect with
Yeah,
terpenes.
and the point is really that, it's the same thing with even CBD. CBD needs a little THC, THC needs some terpene. So, and when you use them together, they will have a synergistic effect where you can actually use less THC to avoid the psychoactivity. And each terpene has its own effect, and each terpene are usually in certain foods. And there's, cannabis-derived terpenes. There's non-cannabis-derived botanicals that are very similar. Like, let's take linalool. Linalool is found in lavender. It's extremely sedating. It helps with anxiety. So when you look at, an indica chemovar, you'll see that it has linalool and maybe myrcene in it. Myrcene gives you that couch lock effect. And then on the other hand, when you think of limonene or citrus things, it's more uplifting. That's better for people who have depression. Or pinene, also with mood. Beta caryophyllene is probably, one of the best ones because it's a cannabinoid and a terpene in the sense that it activates the CB2 receptor, but it's great for immune function. It should be used with CBD. I mean, it's like, to me, it's like a no-brainer. Someone should just make a CBD that comes with beta caryophyllene and just sell that together, with less than 0.3% THC. And right there, that's just a great anti-inflammatory. So, and that's actually found in black pepper, which sometimes can actually be used to take.
Yeah, that's very interesting. So the question is, a lot of people to this, what are the qualifying conditions for a medical marijuana card in Florida?
So we have these 10 qualifying medical conditions that are listed there, and they're all debilitating conditions, and we would love to see more conditions on this list, such as chronic pain, anxiety, depression, insomnia, which are basically the 4 main reasons why people get a medical marijuana card throughout the United States. But we do have number 11, which says a medical condition of the same kind or class. So let's say someone has anxiety, we say it's similar. The physician has to send in some paperwork, and the patient qualifies. So in my opinion, anyone who has any type of debilitating condition actually qualifies, because any pain condition we can make related to something else, or unfortunately we use multiple sclerosis way too often because MS patients have muscle spasms, they have neuropathic pain, or like, let's say someone has ulcerative colitis, it's similar to Crohn's. So Florida is actually flexible in the sense that we have number 11 so that more patients are able to qualify.
Sure. I think that's one of the things Florida did right, is in class and condition. It really leaves it up to the doctor for people that it should be using medical cannabis.
Right.
Yeah. So if you don't see your condition on that list, please go see the doctor, because you still may qualify for a medical marijuana card. That's kind of the bottom line of that one.
I agree.
Yeah. So why medical cannabis?
So we use cannabis for many different conditions, many different symptoms. I will say, obviously, it helps with chronic pain. We reviewed that survey from Fibromyalgia, anti-inflammatory, and it's not just for osteoarthritis or rheumatoid arthritis or joint pain, but we have inflammation throughout our whole body, in our cardiovascular system, and our GI tract. It's extremely, the benefit of it is that it doesn't have the risk that anti-inflammatories do. You don't have renal failure, taking, a full spectrum CBD, for example. It's also great for muscle spasms. There's a medication called Sativex that is available in many other countries for multiple sclerosis patients, CBD and THC. And so cannabis is great for muscle spasms. A lot of patients say they'll start using cannabis and then they'll just start, stretching, or they'll feel more flexible. It does take pain related to the spasms as well.
Sure. I know as a senior citizen, I'm, cannabis has been very helpful, but also as someone that's fairly active from a standpoint of sport, martial arts, things like that. It's done wonders to be able to help me just be able to not only just recover, but have my body be able to act the way it should act as I get older.
Right, and the point is that even though we're using cannabis for a specific medical condition, patients find benefit, for life. So maybe they, are coming to me for pain, but it's really helping them get a good night's sleep. Or, maybe they realize, well, they use it before they exercise and they have a better workout. So there's many, there's that fine line between medical and recreational, but in general, it all has to do with health and wellness.
So how safe is it?
So the nice thing about the cannabinoid receptors is they're not found in our, in our respiratory system. So, or even in the brainstem that control respiratory drive. So there's no respiratory suppression as there is with opioids. And so what they've shown is that when a state has a medical program, there's 25% less overdose. And a lot of this has to do with the fact that there's this substitution effect that people are not using opioids now, they're using cannabis. And so there is safety on using the two of them together because the receptors are not located in the same place, but a chance for overdose, there's no toxicity. It's, one of the safest plants or medications we can use.
Sure. And I think that's very important, that people should feel comfortable. No one's ever died from it.
Yeah, nobody has ever died from it. And that's why if I have a 90-year-old patient, I still talk to them about fall risks and minimizing the high, but at the same time, there's no chance of overdose. So when you combined opioids, and that's how we use cannabis, you don't, like I had a patient today who said, most patients say, do I have to stop my sleeping pill when I'm starting cannabis, or do I have to stop my opioids when I'm taking cannabis? The thing is, you're not going to be able, if you're not sleeping well and you're on a sleep medication, and if you have chronic pain and you're on opioid or anyone for cannabis, you're probably not doing that well anyway. So you're not going to be able to stop your medication and then start cannabis. So it's always something that we add. And then when you're feeling better, we start to wean off. And so there's really this opioid sparing effect where when you take the opioids with cannabis, they have more pain relief and they're able to lower their opioids. And there's also less of a chance of withdrawal because the cannabis actually helps with that restlessness or agitation, helps with their pain, their sleep. So it's a great option to help people.
Sure. Here's another survey from California that you might find interesting.
So this was a big survey done, almost 3,000 patients. And it's interesting, again, because look at the main reasons why people are getting their cards. So chronic pain is the most common, anxiety, insomnia, and depression. And that's really what I see. Those are the four most common. And look how many, 63% with pain. And that, to me, that should be obviously qualifying conditions so that we don't have to go through the extra paperwork. But in general, 97% said that they felt cannabis enabled them to decrease their opioids. 92% felt that cannabis side effects are more tolerable, constipation, a lot of cognitive issues. 82% felt cannabis alone is better than even combining the two, and 93% would choose cannabis over opioids. So it's a great survey just really showing that should have access, and it's just unfortunate that it's not covered by insurance the way the opioids are.
That's true. True. So tell us a little about hemp oil.
Right. So CBD can be derived from hemp or from marijuana, and cannabis is the genus, and the marijuana and hemp are the species. I think I got that correct. But not all marijuana is cannabis. But cannabis is really the word that we should using, and that encompasses hemp as well. CBD can be derived from hemp or from cannabis. There's obviously more THC in cannabis or marijuana, but in general, you don't need a marijuana card to buy a full spectrum CBD product, and that it just has to have less than 0.3% THC, which means there's no potential for intoxication. In Florida, our wonderful Commissioner of Agriculture, Nikki Fried, and Holly Bell as well, have made it so that everyone who's got a permit through the Department of Agriculture, so that all of the oil is, and that's really important because there was a study done showing that more than 70%, as of 2 years ago, of CBD tinctures that were taken randomly off the shelves were mislabeled, meaning they had less CBD than they claimed on the label, or it had too much THC. So this whole industry is trying to establish itself as a medical industry, and so now everyone who's selling it has to at least go through this process, which is great. It's very important because hemp and cannabis are biohazards. Every time you take it from the soil, there's other things like pesticides, mold, yeast, everything needs to be tested. So you get a certificate of analysis which shows exactly what's in it. And so there's many patients, especially fibromyalgia patients, which could use a full CBD product and really get some significant benefit even without getting their medical marijuana card. But in my opinion, it's always better, even if you are using CBD on a regular basis, just to get your card and go through the process just to make sure everything is safe and you know exactly what you're getting, and then you have more options.
Yeah, I think that's an important point. It's always good to have a medical marijuana. I think one of the things I will compliment Nikki Fried in that whole program. She really set the standard here in the United States for really packaging and labeling for the consumer. Because 2 years ago we did a study of 132 different CBD products and found 134 CBD products. We found 132 of them were mislabeled,
Wow.
which is very fascinating. And the consumers, candidly, you can get them at gas stations, and they were buying junk. And of course, the natural reaction was they don't work. Well, naturally, you're not getting what you pay for. So they've done a great job. I think they should be complimented. And I know a lot of other states are now starting to the regulations very similar to what we have here in Florida. So tell us the difference between THC and CBD.
Right. So again, these are two of the cannabinoids, but they have very, very different mechanisms and effects. So THC does bind directly to the receptors. It looks like anandamide, which is an A2AG, the name of our endogenous cannabinoids. And so because it binds to the receptors, we use it for cancer patients to help with nausea, stimulate their appetite. We use it for pain, muscle spasms, and sleep. CBD, on the other hand, it inhibits the enzyme that breaks down our naturally occurring cannabinoids, which is called FAAH. And so it weakens the psychoactive effects as an anti-inflammatory. It's great for anxiety, pain, and it's an antioxidant. But again, the two of them together have more effect than each of them individually.
Sure. So what about dosing? That's probably one of the most important elements involved in the use of cannabis.
Yeah, so because everyone has a different endocannabinoid system, a different tolerance to THC, a different history using cannabis, let's say, everything should be personalized. And that's really like the future of medicine is personalized medicine. And a lot of it has to do with our endocannabinoid system, what we're eating, how we're sleeping. And a lot of it has to do with really having a well-regulated endocannabinoid system. So in terms of dosing, the phrase is always start low and go slow. We do that because we know exactly when the patient feels the effect. So we want to always start low and slowly, especially with THC, to make sure that they're not having any type of psychoactivity. The route of administration is really important, how fast they want it to work, how long they want it to last for. And I always have people stay consistent before negative effect. But let's say they start off with 10 or 15 milligrams of a full spectrum CBD. They take that for 2 or 3 days, and they go up to 20 milligrams, and they stay on that for 2 or 3 days, and 25 milligrams. For THC, we start at maybe 2.5 milligrams and increase by 1 milligram every 2 or 3 days. And it could be because that day, maybe, they had a bad day, they didn't sleep well. So we usually wait a day or two to make any type of changes. And then, the ratio is really how much CBD do they need to mitigate any intoxication. And then, or if they're okay with the potential for, feeling that psychoactivity of THC, maybe they're going to sleep, maybe they don't need the CBD there. And it's really a biphasic curve as we're increasing the dose, their spot, and that's really where they're going to get the most benefit. And then with cannabis, more better if they, a lot of times, especially, I just had a patient today who likes to, roll on joints, and she smokes a whole joint herself. And I said, what if you took half? I'm sure you would feel just as good. A lot of times you're wasting the products, you're wasting money, but there's a like a ceremonial a lot of people have around cannabis, and that's a big part of it too, that social part. But more isn't better for many reasons, so I like patients to really understand where that sweet spot is, and they're overusing it, let's say, and that's also not always great, because you tolerance and you'll have less of an effect over time.
A lot of patients have asked me about this whole dosing, and one of the things I find interesting is, and I'll use alcohol as an example. I have friends that take one and they're done for the night. I have some other friends who drink the whole bottle and they're just getting started. Every body is different. They have, in the case of alcohol, they say your metabolism is different. The same applies to cannabis. Every person's body reacts a little bit differently to cannabis. And just like in alcohol, you find out whether you like light alcohols or dark alcohols, whether you like the vodkas or the bourbons, and you find out whether you like it with an umbrella on it or not. The same thing is with cannabis. I think you have, not only it really works for you, but I think by listening to your body and in working with your doctor, cannabis practitioners, you can find your sweet spot. It's not something that's impossible to find.
And I'll add something, Dr. Weiner, she's talking about milligrams. And when we're looking at cannabis as medicine, we need to understand the milligrams that are in our cannabis products, and understanding the amount of milligrams that we need for CBD and THC that are going to react properly with our bodies. So a lot of people, they say that sweet spot, and it's about one drink or 5 milligrams or 10 milligrams. I think that's the important with having quality products that you can find at a dispensary like ours, where you're going to be able to break down that dosing, and you're going to understand, like, let's say if you go with a CBD tincture, for example, one drop is going to be 1 milligram or half a milligram. I think that's very important for people to start finding what's the adequate dosing for them. Because yeah, if you're going to be smoking one joint by yourself, that could be really 50 to 100 milligrams of THC, and your sweet spot could probably be only 15. So you're not going to need that much.
Right.
Sure. I mean, the concept of milligrams is very similar to the concept of proof in alcohol. But yeah, I think you have to pay attention. And that's something that when you find that sweet spot, trust me, I have 7 herniated discs in my neck from an auto accident. And once I found my sweet spot, I got my life back. So it's something that is a bit, but you do have to pay attention to it. It's something that's it's really key. So one of the things, Dr. Weiner, is these dispensaries that we go to, they're very, let's just say that they're high quality.
What's that a picture of, Claus?
I mean, as you can see here, this is a picture of inside one of our showrooms, dispensaries. For people that have never stepped their foot inside one of our dispensaries, they're completely safe spaces. We have staff that is very knowledgeable and is very helpful. And again, they're state-of-the-art facilities. We're going to have a large number of products. In a slide a little bit later, I'm going to read a little bit about our company's information. But what you can see here, it's just what you can expect when you walk in. It's safe. It's a pretty much brand new facility, and we have facilities all over the state. We are the largest provider in the state, and right now we're at 83 dispensaries open in Florida, along with the local state. So you'll be able to
83?
find. Correct. We're at 83 right now, and then when you walk into one of our stores, you will be able to find a large number of options for both THC, CBD products, and also ratios, which are going to be combinations of CBD and THC products in there. So you're all invited. You are going to have to see one of our great doctors, like Dr. Michelle Weiner here in the state of Florida, to get your medical marijuana card. It's a very simple process. It's going to take about 5 business days for you to get approved from the first time. You can either come to the store and purchase your order there. You can set up an order online for pickup, or you can get it delivered anywhere in the state of Florida.
Yeah, and it's important to point out that these facilities are more. I'm a techie, so it's more like Apple stores than they are head shops. These are very clean, very safe environments to go in. I wouldn't be worried about the quality of the environment and how safe you are when you're there.
Yeah. One other thing I'd like to bring, it's the certificates of analysis, and they're abbreviated to COAs. That is something that's fundamental when you're purchasing a cannabis product. Might it be, from a dispensary that you're looking up your COAs, your certificates of analysis. It's the THC percentage or the CBD percentage. You're going to be getting terpene breakdowns, but you're also going to be testing for materials that could be in that product that need to test negative. So Dr. Weiner mentioned the different, let's say, metals or toxic materials that you can find in soil where you grow these products. When you have the certificate of analysis, all these panels are going to be tested and they're all going to come back negative. So it's just going to give you assurance that the product that you're getting at a certified dispensary or a legit dispensary, like, going to be completely clean, and it's going to be good quality products that are just going to be beneficial for your body.
Right. So let's talk about the routes of administration. I know that when I first got in business about 8 years ago, I didn't view everybody sitting down, smoking joints. I know we've come a long way. The ways of taking it. Both you've heard of tinctures, edibles, topicals. Why don't you demystify that a little bit for us, Dr. Weiner?
Sure. So we break it, like, the way I look at it is always to work and how long you want it to last, and then whether or not the patient with CBD for the medical benefits of CBD or the ability to mitigate the intoxication. There's many people who just say, you know what, I'm not going to start vaping or smoking. And then we look into other routes. There are people who say, I've been smoking for years, and that's pretty much all I'm going to do. And it's then trying to educate them. And so, there was a big study done, and they show that really smoking cannabis doesn't increase the risk of cancer. It just can increase the risk of bronchitis. And not to say that bronchitis is okay, but a lot of this has confounding issues with cigarette smoke. But in general, vaping and smoke from our lungs into our bloodstream, it's the most bioavailable. We're not losing our GI tract or our liver, but we still are smoking or having something entering our lungs. So I tell patients who want to use flower, which again has the entourage effect and the most benefit of the plant, they can buy a vaporizer and make it subcombustible, so they're not allowing carcinogens into the lungs. So that's probably the safest way of doing it. The vapes, they're very convenient. They're very easy. I think that a lot of patients use them too often because they just have them around, and that's kind of the fastest way to really build tolerance. But vaping is great for the same reason that if you're somewhere and you can't smoke, let's say, it works very quickly. You can have CBD in it or the other terpenes as well. Topicals, it all depends what else is in the topical, whether, beyond the skin, but it can be great for certain pain conditions, muscle spasms, neuropathic pain, or even type of skin conditions. Tinctures are usually the first way that patients start to be introduced to cannabis, and that's because it's reliable. You can use 2 milligrams, 10 milligrams. You can get all different ratios of CBD to THC. The most common is probably a 1-to-1 ratio, where it has the same amount of each. That's used a lot in fibromyalgia and pain patients, and that's the entourage effect, but also because if it's daytime, maybe they want to take 3 milligrams, and at night, maybe they want to take. So the tinctures are a good option. Capsules tinctures will usually work about 30 minutes or so, last around 6 hours. Capsules or edibles may take a little bit longer. Edibles sometimes, can take up to 2 hours to start to work. And then duration is usually 6 to 8 hours. Edibles are very convenient. Make sure they're packaged and kept away from children, obviously. And with edibles, you can always break them in half. So the biggest issue I have with capsules is they mainly come in 10 milligrams. And for patients who are naive to cannabis, they between 2.5 and 5 milligrams. And so one option is to use a tincture, obviously. Another is to break an edible in half. The biggest issue with the edibles is waiting for the effect. And because cannabis it needs fat in the body to actually take it into the bloodstream. And so that's kind of why we have these nano products, which I think we have a slide on. But the point is that there's transdermal patches, which could be systemic. They could work just in a specific area. The sprays, are kind of similar to tinctures in the sense that they're sublingual. Suppositories we use sometimes when patients either have, let's say, colon or closer to the area where they have an issue, or if they want to have less psychoactivity, suppositories are an issue. Some patients make their own suppositories. But the nice thing about cannabis is there's all these different delivery methods. There's something that's going to work for someone based on the time of day or, what type of symptoms they're having or what other medical conditions they have. So, a lot of people don't even realize there's so many ways to do it besides just actually smoking flower.
And I think it's important to point out, you don't have to stick to just one route of administration. And I'll use myself as an example. I mentioned earlier, when I wake up in the morning, I can have a lot of pain. Sometimes my pain is on a scale from 0 to 10, is a 7. And especially right after I had the accident, that was something going on. And so obviously right on my bedstand, I have a tincture oil, which I use in the morning, and it takes anywhere between 20 to 25 minutes to work for me. But I don't want to live with that level of pain for 25 minutes. So next to that tincture oil, I have a vape pen, and I take 1 or 2 hits from the vape pen, and literally within a minute or two, that pain level goes from a level of 7 or an 8 down to a 1. So you can mix and match. So the inhalation works really well, but it only works for about 2 to 3 hours. Where while I'm waiting for the tincture drops to kick in, I can have the pain relief and then let the tincture drops take it from there. And in my particular case, I have a regime that I have to use 3 times a day because the herniated discs aren't going to go. I have to do something in the early afternoon. I have to do something in the evening. If I sometimes forget my evening regime, believe me, it wakes me up in the middle of the night, if definitely in the morning. So mixing and match also okay. But that goes back to what Claus was mentioning earlier. Pay attention to the milligrams that are in there. It really helps you find your sweet spot. So tell me about seniors.
So seniors, seniors really have been the population that has increased the most over time in terms of using cannabis. And a lot of times it's really because they've tried and failed everything already. They're frustrated. They've been through all different physicians and they have issues with sleep. These are, common things, or they actually, as we get older, we make less endogenous cannabinoids. And if you ever, really take a look at our patient population, you'll see that people who are older have more of our chronic debilitating conditions. And this is probably because their endocannabinoid system isn't optimized the way it is when we're young. So, the way that we can be eating well and exercise, but taking cannabis, taking a form of, full spectrum CBD or cannabis is a way to help us produce more endogenous cannabinoids. Patients who end up with, let's say, Parkinson's, or, it's an issue with their dopamine or depression. Obviously, it's more than just serotonin. There's many factors involved. And so these neurotransmitters are out of balance because our endocannabinoid system is not balanced. And so cannabis is really used a lot in this population. I had someone who came to me today, for dementia. Her daughters, it was really the fact that she had issues. We were talking, not just treating her dementia, but we're actually helping her sleep and we're helping her anxiety levels. So cannabis can have so many different parts of someone's life. And this population, I feel like we don't want to give them more medication, more pharmaceuticals that may have certain toxicities and drug interactions. So cannabis is one of the safest meds that we can use. And this population is surprising us. A lot of times they come in with a daughter or a son and they have a million questions. And then like the 85-year-old is like, just help me already. I want to sleep. I want to feel better. So it's nice seeing how this has evolved. And I have a huge portion of my practice is seniors.
Sure. And by the way, that's true across the country. I've been dealing with some people in Texas, in Georgia, Ohio, other places, and this isn't not uncommon. Seniors are discovering medical cannabis. That's for sure. Also, how can you get addicted to it?
Right. So really, these numbers are from people who are arrested, for possession of cannabis, and they put them into, a certain rehab or whatever it is. And so these numbers are really not accurate. 9% dependence. It's really not an addiction. And when we say dependence, it really means that if you were to stop every day, you wouldn't go through any life-threatening withdrawal the way you would with benzodiazepines or opioids. It's just that your body becomes dependent on cannabis because you're starting to feel better. And in that sense, a lot of cannabis over time can decrease their cannabis dose and take less medication because their body starts to produce more naturally occurring cannabinoids. They start feeling better, and their master regulator, their endocannabinoid system, becomes more imbalanced. So there's no addiction. I will say that cannabis use disorder does exist. People use too much cannabis. They build tolerance to it. And that really is, a real condition. I think that we want to try to avoid that by teaching people how to use it and how to dose themselves properly and not overuse it. Opioids, there's been studies looking at CBD decreasing cravings for even heroines. It's really something that's what we call harm reduction, much safer than other substances. And in general, patients who are using too much cannabis, I usually tell them to take 1 day off a week, which is really difficult. So then I'll tell them to take 2 or 3 days off every 3 months. And then actually Dustin Sulak did a study showing how after just 2 or 3 days off, it resets their endocannabinoid system to what they were taking before with the same effect. So it helps in just a short period of time reset everything so that patients are able to save a lot of money and also decrease their dose a little bit.
In my particular case, I take what you call a holiday every about 6 weeks, maybe 7 weeks. I'll actually take a day. I try to take 2 days off just to be able to let my body basically recharge. My body can get lazy and not produce the endocannabinoids it should be. And so it just helps me be able to regulate. And I find that cannabis is more effective afterwards. But in my particular case, because I have herniated discs in my neck, if I take off, about the end of the first day, definitely into the second day, my neck is tapping me on the shoulder and saying, "You better do something because the pain's coming back." So I'm not addicted to cannabis. I'm addicted to getting rid of my pain, and I think there's a difference in that.
Yeah, and the problem is there's no substitute during those 2 or 3 days. So
No.
It's very different, especially pain patients, to take the holiday, but it's worth it. I tell patients, they could still really use their CBD, and a lot of it really has to do more with their THC milligrams.
Right, and I can tell you the pain medications that I was given, the side effects are just not fun. It's a night and day difference. I mean, I've got my life back by being able to use medical cannabis. But again, the holidays I think are important, and that's something we should.
Are they also called tolerance breaks?
Yeah, so they a lot of people will call them tea breaks. Tolerance just basically a break to reset your receptors so that you're building tolerance.
Sure. Let's talk a little bit about chronic pain.
So this is really what I was mentioning before, but oftentimes I find like cannabis can be used as a crutch. And what I mean by that is if someone has pain, they start to use cannabis, they start to feel better. It's like having, a fracture. It's the bone starts to heal, and then the body starts to support the rest of this process. And so a lot of times in the beginning, their cannabis dose to you know, a lot of times cannabis will help patients make changes. They'll start to feel better, eat better, exercise, eat better, and all of this will help them over time decrease their dose and then really just appreciate what cannabis is doing for them. But I think a lot of chronic pain practitioners don't really look at the whole person. They're not really treating the whole person, and our central nervous throughout our entire body, and so a lot of times we have to treat more than just the tissue, but actually their emotional and psychosocial experiences. And so because of that, people say the negative or adverse effect of cannabis is the intoxication. I generally, maybe after my first follow-up with the patient, will tell the patient to actually experience the effects of THC, in the sense that I don't want them to be scared of capacity to alter their consciousness. And so the psychoactivity, can have some benefit as well. It helps someone connect with themselves, connect with others, see their disease as not just their disease, or see them as more than their disease. They can connect with nature, so I think that we shouldn't look at cannabis as psychoactivity, and that it has that potential. And if we're home and we're using it in a very safe environment, it can actually have a lot of therapeutic benefits. And it's just amazing how a lot of people are in this, they're kind of stuck in a loop, and so it's nice. Sometimes cannabis can just open that door or change their perspective very quickly. People use cannabis and immediately their face changes, the way that their body is, it completely changes as they relax, as they get out of their head. I think, if you look it up, it's like a side effect of cannabis, or an adverse effect is psychoactivity too. I don't want people to be scared of that. I just want them to understand it and know how it affects their body and use it properly.
Yeah, I think that one of the things that's important is that cannabis is something you use every day. It's very much along the lines of let's say a vitamin supplement or something like that. It's not take 2 pills and call me in the morning type of an approach. If you use it on a constant basis, I know in my case, because of the inflammation, after I used it for literally 6 weeks, I could feel my neck getting better, and a lot of it had to do with the inflammation. And when I continue my treatments, it definitely over time has really helped the inflammation quite a bit. And of course, the inflammation going away relieves a lot of the pain.
Quick question for Dr. Weiner.
It's there.
Talking about consciousness, and is that why people are kind of like resorting to cannabis with all this stress that's being generated through all this pandemic, and all the anxiety that's been caused by it?
Yeah, I mean, they said cannabis is essential during the pandemic, right? I think that we're using it for so many reasons, but I think people are starting to realize that the ability to alter our consciousness has a medical benefit. The fact that you can actually, for a little while, take a break. And so, one concept is really just altering level of consciousness, which we talk a lot about with, ketamine and this whole psychedelic renaissance. The fact that cannabis can actually make new neural circuitries and help parts of the brain connect to each other. So using cannabis over time actually reinforces this, and neuroplasticity is amazing. The fact that it's plastic, it can change. So even though someone may have fibromyalgia and this is their diagnosis and maybe mindset they're living, this is my story, this is my narrative. Well, using cannabis can get you out of that story. It can help kind of make a new coat of snow so that you can really get out of the situation you're in and have unity. So that's why over time, I like patients to have that experience and not really be scared of it, as long, again, as they're in a safe, supported environment.
Sure. So let's change topics for a second. Talk a little bit about Trulieve. But before we do that, Claus, if you don't mind, I'd like to mention to everybody, as a follow-up to this webinar, an email. That email will contain a copy, it'll give a link to a YouTube video of this particular webinar. It'll also have a copy of the presentation, a copy of all the notes, the resources that are there. So you'll be able to, if your friends have missed it or you want to be able to replay part of it, you can be able to do that. be getting that email. And for the folks on Facebook, if you send an email to events@marijuanaaware.com, we'll make sure that you get a copy of that particular email as well. So there is follow-up that's being done. And when we finish with Claus, we'll jump into a lot of the questions that are out here. We have quite a few. So Claus, tell me a little bit about Trulieve.
Yes, of course, Marc. Thank you very much. And Dr. Weiner, thank you so much for the information and the presentation. Dr. Weiner is definitely in the whole state of Florida, not just for cannabis, for many other things. And her time is very valuable. So thank you very much for being with us today. It's definitely a pleasure. I'm going to read a little bit about Trulieve, and I just want to share a little bit of information for everybody to get to know Trulieve as a dispensary and as a cultivator. Trulieve is the first and leading medical cannabis company in the state of Florida. We have a vertically integrated seed-to-sale operation. Trulieve currently has over 550 SKUs, fresh and exciting items to its product line. Its widespread dispensary network and delivery fleet provides important, much needed access to thousands of patients every day throughout the state of Florida. Trulieve is committed to growing its dispensary footprint in the state, constantly identifying new locations that will bring Trulieve closer to patients, allowing many more people to have easier access to the medicine they need. We currently have 83 stores in Florida and 87 stores nationwide, with more growth ahead. That's pretty much where we are right now. As I said earlier, we have 83 stores here in the fleet that's providing access for patients all over the state. So again, you can either come into their store and purchase our products, or you can set up an order for delivery. It'll come next day.
One of the main advantages, I think Dr. Weiner mentioned earlier, is your Nano Technology.
So now, we have it right here. If Dr. Weiner doesn't mind, I can explain a little bit about it. The Nano Technology, it's part of our product line. The interesting part about the Nano Technology is that the cannabis particles are put through a process called sonification. So basically, the cannabis particles are blasted, making the particles much more smaller. So when you are consuming any type of cannabis product, let's say a tincture, the bioavailability and the absorption rate, it's going to be much higher. Your body, it's going to be much more faster, a quicker onset. So I'll let the rest on Dr. Weiner, which pretty sure she has a lot of info.
Oh, that's right. I mean, there's mainly two components. It's the sonicator, which is almost like, in a mechanical ultrasound, actually makes the particles very, very small, but also just turns cannabis into a water-soluble form so that it needs free fatty acids and bile salts in your body to then take it to the bloodstream or the aqueous layer of the small intestine. And the point really is that when you use cannabis, you have to, it depends what you've eaten, how much you've eaten. So that's such a big component of it. If someone is, doing intermittent fasting and they in the morning, maybe it's not going to work for them until they eat something. Or if you use cannabis with fat or oil, it'll work a little faster. So the nanotechnology takes out your diet completely. It just makes it water soluble, so it has their onset. Then it also doesn't go through your GI tract or your liver, so you don't lose a lot of it, that part of your body, which is important because it means that the body is using it in a very efficient way. And also a lot of medications go through our liver, and by bypassing it, it's basically the fastest way, most bioavailable way after vaping or smoking. It's the safest and fastest way of using cannabis, and it's very reliable.
Yeah. So as a producer, the bottom line is it works faster. It works a lot faster, and it also is something that you notice the water soluble. You can put it in your coffee, for example, or in your smoothie.
Yeah, when you come to one of our, be able to have access to different products that are part of our nanotechnology line. So you're going to have 3 different tinctures. There's going to be a 50-50 THC to CBD balance. You're going to have a high ratio, and you're also going to have a high THC ratio. Those are all going to come in tinctures. We are also going to have our powder, which is a basically THC in powder form. And we also have a few edibles, which are going to be our true gels that are also going to have the Nano Technology. So come check it out.
Kind of interesting. Also, there's been a lot of talk about Delta 8 products. I know that after I had a knee replacement about 2.5 years ago. I started using the products from Trulieve for pain, which was a Delta 8, Delta 9, and CBD product. And now they call it Laugh, which I think is a great name. But Delta 8's been a lot of talk out there. Tell us about your product line in this area.
Yeah, I was joking the other day. We've had Delta 8 since before it was cool. We had Delta 8 like 3 or 4 years ago when you know you didn't find it everywhere. Yeah, the Delta 8. I'm not a medical professional, but basically, the Delta 8 is a non-active particle of the cannabis plant. Delta 9 is the one that has psychoactive properties, but Delta 8, it's still a THC particle or a THC component that doesn't give you psychoactive. So the first Delta 8 product that we launched, it came in our TruePod line, which is a vaporizer. It's going to be the one with the blue cap that you see right there. You were able to use it through vaporizer. So we came out with that about 3 years ago, and then we also came out with Delta 8 in oral forms, which are with our True Clear. Pretty much, you're going to be able to have the benefits of THC without feeling a heavy, intoxicating effect, heavy, heady effect. So that's pretty much what you can expect from Delta 8.
I have to tell you that the TruePod, the 1-to-1-to-1, which you just have renamed, I guess, because I've been using it for about 3 years, Laughing Buddha, to control pain and inflammation, that's been a game changer. I mean, that's my go-to vape pen that I use. I think I mentioned that's one I grab. And I think if you frisk me at any point in time, that's the vape pen that I have on me. It really does help. And I know that in my particular case, getting rid of the pain is important for an active life. And it's something that I would highly recommend. I prefer the 1-to-1-to-1 rather than the 1-to-1 for a number of different reasons, especially the fact that I do have a lot of pain in my neck. It just seems to work a little bit better for me. And that's my particular preference than anything else. But, so let's talk a little bit about delivery and pickup. And before you do that, Claus, I want to mention something. Trulieve does something that is really, I think, remarkable. And that is, if you buy a product and you don't like it or it's not working, you back. I think you're the only dispensary in the state of Florida that has that particular policy. I know people are worried about if I go out and I spend some money on cannabis and it's not working for me, or if it's the wrong particular product, that you're stuck with it. You're stuck with that purchase. You know, it's kind of a buyer's remorse. You've taken that whole buyer's remorse away from everybody, and that's not on the slide, but I think that you may want to chat about.
Yeah, no, it's we've had it since day one, and it's pretty much making sure that the patient journey it's always, you know, it's important for us that patients are satisfied with the products that they're getting. And sometimes it takes time for patients to find, again, their sweet spot and to find. So when a patient is coming to our store for the first time, second, third, fourth, or fifth, they still exploring and seeing what are going to be the best products for them. So we've always had a product exchange policy active at Trulieve. We are the only MMTC or the only dispensary in the state of Florida that does that. And pretty much you can buy any product, and then once you try it at home and feel the effects, if for some reason you didn't like it, didn't taste well, you checked the certificate of analysis and you didn't like something, or you didn't expect the effects that you needed, you just stop using it immediately, bring it back to the store, and we're going to give you store credit you to try another product until you find what's best for you. So yeah, you can definitely rest assured that we have that. We've had it in place, and it's going to be there.
Yeah, and what I love now I'm over the age of 65, but I love the fact that your statewide delivery is really important.
Yeah, well, now with last year with the pandemic, delivery was pretty much, it was huge. So what we've implemented is we do delivery across the whole state of Florida. So from the Keys to the Panhandle, you don't have to worry where you're at. Let's say if one day you're in Orlando and you want to get a delivery, then a few weeks later you're in Tampa, you are not obligated to be in a certain part of the state. You can receive, you have to be present and you have to sign for it. So keep that in mind when you're placing an order for delivery with us and any other dispensary in the state of Florida. But pretty much anybody that's over the age of 65, it's going to have free delivery. Any order that's over $200, it's also going to get free delivery. And if you don't qualify or you don't fall into any of those categories, it's only going to be a $15 flat fee for delivery anywhere in the state, and it'll be next day. We also have online ordering for you to set up your pickup order. So pretty much you can go to Trulieve.com. You're going to register your profile, and you can choose the store that you're going to pick up your order for products you want to get. You know, your Delta 8, your Nano products, whatever it might be, and you ask it. You're going to save that order, and we're going to package it for you, and we're going to let you know once the order is ready. Once you get that notification, you can head over to the store, and then you can pick up your order, and you're going to have an expedited. So those are pretty much the different forms that you can come to our stores or place orders, or you can also walk in, and you can just walk into the store and check in with our true host, and then go into the showroom and purchase whatever products you need.
Yeah, I know that, again, going online, you can obviously schedule the delivery as well as schedule an order. What I love about the express check-in, because there's a Trulieve dispensary in the city that I live in, look, you're busy. There's a lot of people, especially during the pandemic, that were going to dispensaries and trying to get products. And if you just walk in, sometimes you can have a rather long wait. I know that when I placed an order, before I left the house, I would go check in. And when I got to the lobby, literally within 5 minutes, it was ready for me. I could pick it up back. So I found that to be very helpful, extremely helpful. That's out there. And again, you can register at Trulieve.com for an account. So, and then you have some discounts, right? Let's not forget the whole program.
Absolutely. So just to bring a little bit more information or education into the potential patients, if you've never been to one of our stores, the transaction, it's either going to be cash. You can use your debit card to pay as well, or you can use an application that's called CanPay. Those are going to be the three forms of payment that you can utilize at the store. We also have ATMs at every store if you want to withdraw your money and pay cash, but just keep that in mind when you're heading into any of our stores. We have a Truliever rewards point, which means every dollar you spend, you're going to get 1 point. Once you accumulate 500 points, you're going to have a 10% discount. Of new patients, you're always going to have 15% off on your first order. And then on your second order, you're going to have a $75 discount off the whole order of 150 or more. That $70 discount is to offset the cost of the state ID card. You're going to have to pay $75 every year when you're renewing your card. So just keep in mind, if you're a patient for multiple years, every time that you pay for your state renewal, you are going to have that $75 discount. So that's going to be a yearly discount. On any order over 200, like I just mentioned, it's going to have a free delivery. On your birthday month, you have a one-time opportunity to utilize a 25% discount. Veterans will get 20% off on every single purchase. If you have a SNAP card, if you're a SNAP card holder, you're going to qualify for 10% off every order. And then on Sundays, all patients of the age of 55 and over, they're going to have a 10% discount. So that's going to be every Sunday. If you want to stay connected and you want to receive more information about specials, different products, store openings, which we're opening store, I suggest you to visit our website and sign up for our newsletter and our text alerts. And that way you be able to get all the news from Trulieve. And just to wrap it up, I would invite the new patients, new and old, to always visit different Trulieve stores around your area until you find, where you're going to find your best service, your favorite store. And a lot of patients have been seeing that we keep expanding and we keep opening new stores. Go to our website, check your zip code, and make sure that we don't have a newer store close to your town or city. A lot of people are missing out on the newer stores because they're always going to the old store. So just keep in mind, we're expanding every week. And if we're not in close to you, go to our website and submit a request form for a new location as well.
Perfect. Claus, thank you. That's a lot of information about Trulieve. We have a number of questions. I think we ought to probably dive into those.
Yeah.
So, Dr. Weiner, do you want to grab a couple of these? I know Julia had a question. She says, I find I'm educating my docs on both medical cannabis and fibromyalgia. Is there a way to get them in?
Yeah, so there's actually like now I guess because of COVID, there's more conferences that are happening. There's actually one, maybe Klaus knows. There's one coming up I think this month in Orlando. So there's always different conferences. Do you know which one that is?
We have in Naples between the 11th and the 13th of this month, the conference. And also, I'd like to add that in, if you're trying to get education doctor for cannabis at Trulieve, we have a team of community educators that are deployed throughout the whole state. So if you're interested, you can send me a direct message through the chat here and let me know what area that you're located in, and I can connect you with one of our educators so they can bring more information to your doctors about cannabis and how it can benefit your patient population.
Sure. Julia asked the question, is there any advice on boosting endocannabinoids through diet?
Yeah, so I think it has to do with the right omega-3s and omega-6. So that's, where the good fats come into play. So avocado with their cannabis, or, when you're saying like eat fat or oil, you can choose healthy fat. So I think it's just having that in your diet, nuts or, any type of fats are always good. And then also limiting alcohol, cigarette smoking, things like that.
Sure. One of the questions that Zebu asked is it safe for someone with Afib? So
with Afib, we're mainly, we're trying to avoid increasing heart rate too quickly. I think that, or, any type of arrhythmias, I think that THC content are the two ways and the two forms of cannabis that will increase your or cause any type of palpitations. So it's really just, seeing how little THC you actually need, seeing if there's other routes of administration that would work for you besides vaping or smoking. And then, if you're on blood thinners, that's another thing. A lot of people with AFib, we're not using Coumadin as much anymore, but that can affect your INR as well.
Mm-hmm. Great. Do you see any questions, Dr. Weiner? You want me to read them?
Yeah, so one question, but I am in South Florida, and the initial visit has to be done in person, but I'm sure Marc has a bunch of other great doctors in Central Florida, or Trulieve, you can look at other doctors that are, in the area.
We use MMTC of Florida for the doctors in the northern part of Florida. I know, Dr. Weiner, you're now a reference patient, now a reference doctor in the Boca area. I think we're going to add your Hollywood location as well. We'll be able to take advantage of that. And I know that sometimes it's very hard, especially driving a couple hours to see the doctor. You may want to find someone that's local, but I think you are taking new patients. It's just the logistics of it might be difficult. Is that right?
Yeah, definitely. So, and this is a good question. This is about weaning someone off of opioids. So the way that I do it is I usually patient like tramadol, for example, and let's say someone takes that 2 or 3 times a day, I'll just first start them off usually on a 1-to-1 tincture, maybe 3 to 5 milligrams, and take away one of the short-acting opioids and try to figure out what milligrams of that ratio they need to replace it. Or so it's, a substitute. So then I usually work on the short-acting meds first. Once we get done with that, then we move into the longer ones, like either maybe an edible or a capsule. But it's very simple, because once you learn how, what ratio, what milligrams is the most effective, then you're able to easily start weaning off the medication. It's just it's a marathon, not a sprint, right?
Yeah, exactly. Exactly.
So someone else said I want to add, someone else talked about a new blood test. I actually knew about this for fibromyalgia, but I'll look more into that. I've heard, because there's some people who are doing this test now to diagnose for fibromyalgia. I think it's interesting. I just think that usually someone's story and symptoms and history can give us that diagnosis, but I do interesting that they're looking into these more specific tests.
Yeah. Kelly asked a question. This is other patients of fibromyalgia finding if they don't use medical cannabis daily, they begin to feel low and sad. You have a comment about that?
Yeah, I think that has to do with dependence. I think people get used to feeling well, and it's something that, as you were saying, becomes more of a daily thing. If you're using it for chronic pain or depression, then this is, like other medication, it becomes a daily medication. Then your endocannabinoid system doesn't feel the same way it did, the day before. So that is something that is similar to pharmaceuticals in the sense that we take it on a daily basis. It's just a matter of using at what time, and it's nice in that sense that people have a whole medicine chest full of cannabis products as opposed to pharmaceuticals based on what they need to use. So it makes sense in the sense that become dependent on feeling well.
Well, that's the whole thing. I'm not hung up on cannabis. What I'm hung up on is getting the pain and feeling better. And let me tell you, when you feel better, your attitude, your outlook on life definitely is a lot more positive.
So someone asked about Rick Simpson Oil Rso. This, and it's a concentrate, in my opinion. It's very high percentage of THC. Rick Simpson had cancer. He made a Rick Simpson oil based off of how he used it for his own cancer. There's the concept of using 60 grams of cannabis in 90 days. It's a lot of cannabis. Very unlikely that the person's not going to be high, unless they've been using cannabis for a long time. But some patients use this as kind of a last resort for cancer, in the sense that they'll build up, loading up more at night. But in general, some people just use Rick Simpson oil as, take a grain of rice size, use it at night, help you fall asleep. Even though Rick Simpson made this for, he's a cancer patient, and then we talk about this with cancer patients, a lot of people just use it for sleep and for pain. It comes in a syringe. It's usually black. Some patients even make it themselves from flour.
A question I have here is, how effective is RSO with fibromyalgia?
The thing is that would have to, so someone who has fibromyalgia, person wouldn't be able to use that unless they really started to use cannabis on a daily basis. If they use RSO for their first product and never used it, they'll probably never use cannabis again, because the THC percentage is very high, and they will definitely feel the psychoactivity of it. So someone is more tolerant to cannabis, it's not their first time, and they're maybe using 10 milligrams of a 1-to-1, or even 10 milligrams of THC by itself, maybe they could try some RSO at night. But overall, it's pretty cost effective, I would say. It's just that someone who's using RSO has to be a pretty experienced cannabis.
Actually, because of the euphoric effect, using it at night and using it able to sleep is really highly recommended, especially for new users, I would think.
This one, which THC edible or ointment is best for getting some sleep? So I would say, an indica edible, obviously, or something with myrcene in it, some linalool in it. If you have a problem falling asleep, you can try the nano edible, so they have a faster onset. If the problem is staying asleep, then it doesn't really matter if it's nano, because it will last long. And also, Trulieve has CBN. CBN is another cannabinoid that can help with sleep. If people don't want the intoxication of THC but want to sleep, I'll generally recommend CBD with CBN.
And we just recently launched, with our partnership with Blue River, a True Gel, which is basically a gummy that is a CBN CBD combination.
Great.
And
There's
then
a question that I had about home delivery. It says, I got home delivery from Trulieve. I was told no. Can clarify that. I think they shouldn't have a problem getting home delivery, should they, Claus?
Yeah, no, I mean, so when we get the orders for home delivery, our staff members at the store, local store that's going to be making the delivery, they're verifying each patient's information. So if, let's say, a patient's recommendation it's expired, or their card is expired, or let's say they don't have enough milligrams on their order history, they're going to get a call from our store letting them know that unfortunately we're not going to be able to service that delivery, and we're not going to be able to take it to them. So it could have been the case where maybe the patient had an expired order and we couldn't fill it for them. That's the only thing that I'm thinking of. But if your card is active, if you have milligrams and you place your order online and everything checks out, you're just going to get the email and a text message and probably a courtesy call. You know that the order is going to be on its way and they're going to give you a time frame for delivery. You just got to be home or wherever you're ordering the delivery, and you have to be there in person, and you have to sign for it, and you also have to pretty much proof of ID. You got to show your ID to prove your identity that it's the actual person receiving it.
I guess on the chat is what are the options for chronic pain patients who live in a state that doesn't have legalized cannabis? Any thoughts on that, Dr. Weiner?
Yeah, you can get Spectrum CBD product. You can even buy some places sell CBG, CBN, some products that you can still use different cannabinoids, different terpenes. It's just going to have less than 0.3% THC.
And I think some Delta 8 products might help as well. Would that be right?
You got a small window when you can get Delta 8, I guess.
Yeah, it's there. Last question I know that came in. This is more of a logistics issue. Amanda asked, Alabama's Governor Ivey has approved medical cannabis. Will Alabama patients be able to get medical treatment and use Florida's medical marijuana doctors and dispensaries now? And what should Alabama residents need to do?
So I think, I think that it really goes by state. So like, for example, if you have a Florida card, it's only good in Florida. I can only recommend cannabis to Florida patients or residents. So every state kind of has their own programs. Certain programs have flowers. Don't find you can find a dispensary that maybe is in another state that you're familiar with, or you can actually just find a good recommending physician. A lot of times you can get your medical marijuana card, and even if the physician's not educated, you can start educating yourself by doing webinars like this, looking on Trulieve's website, for example, and find a lot of your own information. But it's personal. So, even if, like, some patients they wait so long, they ask a million questions. It's like, look, you just got to start. You got to start at a start low and go slow. I can't tell you what's going to happen, but I could, you can open your mouth and try that tincture. So, that's what it comes down to, and it is very safe, and that's the whole point. Is that people, people want to regulate everything so much, but really, when it comes down to it, it helps so many people. Obviously, it has such a safe profile. If you're worried about getting high, you just make sure you buffer that with 5 times the CBD and start, low.
And the nice part about it is no one has ever died from using medical or from using cannabis in general, rec or medical.
Right.
It's out there. It's there. Well, listen, we covered a lot of territory. We answered a lot of questions. First of all, I want to thank everyone who are viewing this, both on Zoom and on Facebook, for joining us. It's been a rather long. It's been over an hour and a half of material, and I hope the reason we do these is my goal is if I can just have one person get their life back by what we presented today, I think we've accomplished what we wanted to accomplish, and hopefully we can do more than that. Again, if you have any questions or need any material or you want some follow-up, events@marijuanaaware.com is an email address you can use. Of course, naturally, marijuanaaware.com, the follow-up page, we will post by the end of this week, a follow-up, which is the videos of the presentation and notes that are out there. Dr. Weiner, any last minute comments?
I don't know. I think we said it all. You know, it really has to do with keeping everything in balance. So it's more than just, you know, taking cannabis, but it's really making these good lifestyle choices, medicine. And thank you. Claus is a wealth of knowledge, and so is Marc. And so I'm happy to have been able to speak with both of you guys. So thank you very much.
Yeah, well, thank you. It's been really helpful. Claus, any comments?
Oh, I mean, I'll just echo what you just said. Thank you, everybody, for joining us today. And if you all need more information, please visit Dr. Weiner's page, visit Marc's page, or visit our page, Trulieve.com. You're going to be able to find a doctor and find a number of different products that are going to help you or a loved one that might be experiencing any of these symptoms. So on my end, thank you very much, and I hope to see you soon, Dr. Weiner. It's always a pleasure working with you.
Thank you. You too.
And I should mention, next week we're going to be discussing terpenes. Please feel free to join us again, MarijuanaAware.com to sign up for that. And I'm going to mention one other thing. We are over the summer not going to be broadcasting these wellness webinars. We're going to start up again in September. And the reason for that is because we're going to spend the summer really putting some things together. We have a site called Marijuana Med Today, which will be really the WebMD for medical marijuana. We hope to have that up and active by September. With a lot of the medical conditions that give deep dives. I think there was a question of how do doctors find out information. I think that is coming. We're doing a lot to be able to really help patients as well as doctors get accurate information that's there. And we appreciate everybody paying attention. So stay tuned. Please sign up for our webinar. Claus, thank you. We really appreciate the sponsorship and your comments. It's good to work with you again. We've been working about 3 years, and Dr. Weiner, your comments are very timely, and thank you. And we took you away from your kids long enough. Please enjoy it.
Thank you.
Okay.
Have a great night.
Thank everybody for joining us, and hope to see you next week. And please get in touch with us and let us know what we can do to help. Thank you. Have a good evening.